This module focuses on mental health. The role of physical activity in the broad area of mental health as an active area of research inquiry. Mental health involves many concepts and conditions. What is mental health? You may think of these two questions first. Can regular physical activity have a positive effect on mental health? If so, how? Can regular participation in exercise prevent age-related declines in cognitive function and dementia? Also, can exercise prevent Alzheimer's disease? Mental health conditions have been estimated to affect 26.2% of American adults in any 1 year, and the relative increase in medical expenditures from mental disorders rose from $35.2 billion in 1996 in 2006 US dollars to $57.5 billion in 2006. Then, how does the World Health Organization define mental health? The World Health Organization, who has defined mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. It's an essential part of overall well-being. Mental health as a state of well-being, and mental disorders or problems can limit people's ability to attain or maintain functional health. What is the prevalence of mental disorders in the United States? The number and types of mental disorders are numerous, and their prevalence increases as people age. The best information available in the United States suggests that common mental health conditions affect 26.2% of American adults in any 1 year. What are the economic costs associated with treating mental disorders in the United States? Mental disorders were one of the 5 most costly medical conditions in the United States from 1996 to 2006. The number of people associated with these costs for mental disorders almost doubled from 19.2 million to 36.2 million in 10 years. The relative increase in medical expenditures from mental disorders rose from $35.2 billion in 1996 in 2006 US dollars to $57.5 billion in 2006. The total economic costs of depression alone have been estimated to be in the tens of billions of dollars each year in the United States. What are the common mental health disorders? Common mental health disorders include depression, bipolar or manic depressive disorders, medical conditions related to mood changes, substance-induced mood disorders, anxiety, phobias, panic disorders, obsessive-compulsive disorder, post-traumatic stress disorders, feelings of distress, CNS dysfunctions, and addictive behaviors. Tests to detect mental health disorders are typically conducted by physicians, general practitioners, and specialist psychiatrists and sleep study experts. Some common mental disorders have been studies in relation to physical activity and exercise, including mood disorders, anxiety disorders, psychological distress, age-related decline in cognitive function, low self-esteem. Mood disorders include depression, bipolar or manic depressive disorders. Depression can be classified as mild or as major depressive disorder. Dysthymia can be defined as an individual having depression symptoms for the past 2 years, affects 1.5% of the U.S. adults population, and 16% of adults experience major depressive disorder yearly with symptoms lasting 2 weeks or more. Adolescents in the U.S. have a lifetime combined prevalence of 11.2% for dysthymia and major depressive disorder. On the other side, cognitive function refers to the ability to process, select, manipulate, or store information. Age-related decline in cognitive function refers to negative changes that occur over time in the ability to process, select, manipulate, or store information. It affects both behavior and functional ability. Anxiety can be broadly defined as condition of nervousness, uneasiness, or apprehension about a future event or events. Anxiety, although a predictable part of everyday life, can become a mental disorder over time that can hinder daily functional abilities. Anxiety is usually classified as either state anxiety and trait anxiety. Then, what are the differences between state anxiety and trait anxiety? State anxiety refers to a person's existing or current emotional state. Trait anxiety is specific to a person's personality and has been described in general as type A aggressive, high-stress personality or type B low-key, low-stress personality.